Pretty Nurse fam, Andrew here. Thanks for coming back to my channel, or if you're new, welcome. So today's video will be about things you should know before pursuing nursing school, or things that would help set you up for success for nursing school. All right, if you are interested in more material like this or videos like this, hit the subscribe button so that way you get notifications when I release information and new videos. All right, let's get started. So I would say when you first start nursing school, you really need to avoid the mentality of C's get degrees. I feel like a lot of students, they strive so hard to keep their grades up and get into nursing school, and then once they're there, their mindset shifts, and all of a sudden they're like, I just need to pass. And yes, that's true, but a lot of internship opportunities, scholarship opportunities, and jobs may look at your GPA, may factor your didactic grades into whether or not they're willing to take you onto their team or consider you for that opportunity. So I would really strongly suggest that you don't get that mentality of C's get degrees. It's just not going to help you. You need to always continue to strive to do your personal best. And if that happens to be just passing, I would strongly caution you. I would say seek out as many resources and opportunities as you can to maybe talk with your professor, find different books that might help you with studying, videos, different ways of learning. So that way you're not constantly on the cusp of possible expulsion from the program. A lot of programs will require you to maintain a minimum grade constantly, or will only allow you to fail like one exam or something like along those lines. And I've even heard of some programs shifting the GPA scoring system so that way it's even more difficult to get a C, quote unquote. So just be very aware of your program's requirements, their minimum grades, and avoid that mentality altogether. Now, one thing you can expect with nursing school is to work harder and longer than you have ever done for any class before. It's just a fact. You will possibly be attending classes, clinicals, labs, and studying for a total of 12 or more hours a day. And that cuts into your sleep time and your personal life. So setting expectations realistically with family and friends once you're accepted into a program is going to make a world of difference. I would suggest taking your schedule and planning it out as far and as detailed as possible. That way you make time for yourself and for your social interactions with family and friends. It's very important to have a school life balance, and it wasn't something I prioritized, and I wish I had. Another thing I would strongly suggest is learning your pathophysiology. The sooner you learn and understand pathophysiology and the mechanisms of different diseases that you will constantly see, like diabetes, chronic renal failure, heart failure, hypertension, those types of conditions, the easier it will be for you to understand medications for those conditions, lab results, and anticipate orders and the progression of the plan of care. So learning your pathophysiology, which seems to be the basis of almost everything nursing related, will help you anticipate and be on your game a little bit more. I think it is vitally important for nursing school students to know and understand their pathophysiology. Now, piggybacking off of that, it is also incredibly important to understand pharmacology. It won't go away. You will constantly be using medications for your patients. You're not going to have a shift that you don't give medications, and you need to know if it's safe to give that medication to your patient. No medication is benign. You might think like Zofran for nausea, vomiting. That That can't do any harm, right? But no, it can prolong the QT interval. And in somebody who's already taking maybe an antiarrhythmic and they're getting Zofran on top of that, it could be what sets them off into an arrhythmia. So no medication or fluids are benign or harmless. You have to know when to not give a medication. And you also have to know when it's required to still give a medication. A lot of patients with heart failure still get their antihypertensives and their beta blockers even though their heart rate might be 60 or their blood pressure might be 100 systolic. Knowing what the provider wants and what is safe for that patient given their vitals and their current condition is incredibly important. If you don't understand the basics of your medications, you can't make those critical thinking decisions, and that is what nursing is there for. Another thing is, when you start school, it's incredibly important to find and network with a small group of students that are like-minded, goal-driven, very similar in how they approach the material and their drive to what you have to offer. Finding that group of people to lean on, to study with, to discuss clinical experiences, to practice with in clinical lab, it's going to be what makes or breaks you sometimes in nursing school. Sometimes your family and friends won't understand how hard it is to put in an IV and why that may have been the worst part of your day, or something similar. You need a group of tight-knit people that are on your side, that are supportive of your success, that you give and take from, that you can rely on, and kind of divvy up the studying and the workload and make it easier for you to succeed in school. It's just going to make things a lot easier. I know the group that I was with, we would divide up like learning objectives, make our own study guides. We would quiz each other, help each other succeed on exams, and be there to be a second set of eyes when you're doing a lab skill in the practice lab. I think that is one of the most important aspects of nursing school, community, and getting involved so that you have a community to rely on. That's a super important part of nursing school, and one that shouldn't be overlooked. Now, speaking of clinical and labs, you always want to be prepared. So if your school has a skills lab, take advantage of it. If they have open hours, go practice. You're going to need a way to de-stress. And let's face it, we are both simultaneously elated, excited, and terrified of the nursing skills. And you will have test offs where they watch you perform the skill on a clinical dummy or a mannequin or whatever your school is using, to make sure that you are safe and competent in that skill. So these skills labs are incredibly important, and having a support system to kind of be your second set of eyes is going to help you hone in on that skill, perfect it, and ace that test off. Now, another thing is to prepare for your lectures in advance. This is so vital. If your professor gives you a PowerPoint presentation for that lecture and it's given to you in advance, read it. Read it before the class starts. It's so important. I would read it before class started and type up an outline and then fill in new information that the teacher gave me that wasn't on the PowerPoint. Some people would use the notes section of the PowerPoint. That didn't really work for me. I wanted a structured outline, and it helped me succeed. But I also had teachers who would give us a pop quiz at the beginning of class, and it was directly on the material in that PowerPoint. So if you didn't look at that PowerPoint at all, you were at a loss that day. and you had to rely on your deductive reasoning just to try and succeed on that quiz. And let me tell you, those grades are few and far between in nursing school, so you don't have a lot of extra fluff building up your grade. So doing poorly on a quiz could be the difference between you passing and failing that class. So prepare for your lecture ahead of time. Prepare for your clinical ahead of time. Don't let those opportunities go to waste. It is incredibly important. And another thing is to stay organized. There's so many different aspects of nursing school. Like I've said, lecture, clinical, your lab, all of that together, you have your own schedule for each section. And you need to make sure that you have a planner to keep your mind organized and to keep your day scheduled in a way that you can block off time to spend with family or to study and make the most use of your time in an efficient way. That is so important for nursing school students to get very used to very early on. And my final tip for success in nursing school, and something you should always have in the back of your mind, is that you are going to constantly be learning. Your nursing career doesn't end at graduation. You will be learning new techniques, new medications, new skills throughout your nursing career. So it is incredibly important for you to understand that and to be aware that the continuing education is there for a reason. And I'm a firm believer that you will learn more in your first year of nursing as a registered nurse than you did in your entire program as a nursing student. The learning curve is so steep, but the thing you can look forward to is that at least you are doing what you enjoy. Hopefully you're in a unit that you're passionate about, and it makes that learning curve seem less intimidating. So those are my tips for success. Those are the things I think you should be aware of before starting and pursuing nursing school. Kind of a way to give you a heads up so that you don't feel blindsided by these things. So if you want more content like this, more videos that touch on topics like this, be sure to like this video. Let me know that this is something you like to see, and then subscribe so that way you get notifications every time I post a new video. That way it can help you in your nursing journey no matter where you're at. Maybe sometimes you can take something from a video, even if you're past that stage of your nursing career. It's incredibly important that we help each other succeed, and that's what I'm here for. So you can expect that from my channel. Until next week when I post my next video, Study Nurse signing out.